Hi everybody, my name is Stacey. I'm a speech and language therapist at the Energy Source, which is here in KL. So today I wanted to just talk a little bit about autism, and in particular I want to talk about some signs and symptoms of autism. So just before I kind of launch into that, I do just kind of want to emphasize that I am a speech and language therapist, but we don't diagnose autism. There is sometimes a bit of misconception with that, so I just wanted to just confirm that we don't diagnose. If you're looking for autism diagnosis, then you would have to go in Malaysia. You would have to go to a child psychologist or a clinical psychologist or a developmental pediatrician, and then they would do the assessment there, and then they would refer, to speech and language therapy if necessary. But as for the diagnosis, we can work on therapy treatments, but we don't diagnose. So, talking about autism spectrum disorder, because we're coming up to Autism Awareness Month, it's a huge thing around the world these days, which is absolutely brilliant. Autism Awareness Day is the 2nd of April, so I hope you all have, shirts and everything already. This year we're doing #Red instead, so I hope you can all get on board with that. So autism is a neurodevelopmental disorder, and it's a spectrum disorder. So that means that basically the symptoms can vary from very, very mild to very, very severe. Every person who's on the spectrum will have sort of different signs and different symptoms. Every person will present as very, very different, which is why as a therapist, when we assess the child, we have to tailor our therapy techniques to the specific child. So every single therapeutic program that a child has would be individualized to them. So the DSM-5, which is basically how we diagnose everything. I say we, I mean the doctors. I'm just quite familiar with it. Basically, it would require, to get a diagnosis, a person with autism would require difficulties in two different areas, which would be the social communication and social interactions. So you need to have difficulties and behavioural and sensory challenges. So you need to have difficulties in both of these areas in order to get the diagnosis. And just to kind of sort of harp onto that a little bit, the diagnosis would probably not be done just in one appointment. It does take time because, of course, the doctors, they want to be, sure that it's the right diagnosis for the child. And I guess there's still, unfortunately, some sort of stigma attached to autism diagnosis, and it's maybe not so readily accepted having that diagnosis as yet. Getting better, but there is still a little bit of that. So it's not good for us professionals to just rush in and say, "Oh, I think your child's autistic," and it could be something else. You could always present with some symptoms. And it seems like autism, but it might not be. So that's why we have to be very, very, take our time, and we have to be very sure when we give the autism diagnosis. So just to kind of go back again, sorry. In the UK, I would be part of the diagnostic team, but we don't diagnose by ourselves. So the diagnosis would be done by a pediatrician, but I would be part of the team in the UK. Here in Malaysia, it's a little bit different. It would generally be done by the developmental pediatrician. So if you have any concerns, I would recommend, if your child is under 3, go to a developmental pediatrician. If they're over 3, you can go to a child psychologist or a clinical psychologist. So we're talking about kind of signs and symptoms of autism. So the major sign would be difficulties in social communication. So difficulties in social communication means difficulties with verbal and or non-verbal communication. So things like a lot of children on the spectrum, you would see like they have difficulties understanding gestures. They don't necessarily understand tone of voice or facial expressions. So they don't read. So 90% of our communication comes from body language, and if we smile, then it's a positive sign. But a lot of times the children who are on the spectrum, I should say individuals on the spectrum, have difficulties in this area. So they don't pick up those non-verbal cues, which could then lead to some communication breakdowns. So this is one of the major signs of autism. A lot of times as well, children or individuals on the spectrum have difficulties with things like joint attention and reciprocal communication. So often you'll find that they have difficulties maintaining conversations. So this all kind of falls under social communication. So one thing I just kind of wanted to pause for a second and just sort of jump in and talk as a speech and language therapist. I often get children referred to me with a speech delay. And I just really want to talk about the difference between speech and communication and language. So basically communication is when we exchange a message. And like I said before, communication, about 90% of it is done non-verbally. So communication is just any way, whether we point, whether we smile, whether we use our words, it's how we communicate a message. It's the exchange of a message. That is communication. Communication is what usually individuals with autism have difficulties with. It's the communication part. Language is basically a learned symbolic system, as you all, I'm sure, are very much aware of. We have different languages, we have different dialects, we have different symbolic systems, and even written scripture. And then finally speech, and this is what I often get referred to as speech delay. But actually speech is just the sound of the spoken language. So it's those sounds that make up the words, those individual sounds broken into phonemes. So speech would be the use of the muscles, like for example, the jaw, the tongue, and the lips when it comes to speech. So there is a difference between the speech and communication, and it's the social communication that children on the spectrum or individuals on the spectrum usually present difficulties with. So that's just from my speech and language therapy side. I just really want to kind of emphasize that difference because I know it can be confusing. But if I have a child who comes to me and they don't have a diagnosis, then, but they're coming to me with a speech delay, then I might assess them slightly differently than if they're coming to me with a communication delay. So it's just something just to be aware of. I'll do my best anyway, but it's just, sometimes people get a bit confused with the difference between communication and speech. So another big sign and symptom, this is part of the DSM diagnosis, would be children on the spectrum or individuals on the spectrum usually have restricted, repetitive or sensory behaviours. So our interests as well. So for example, it's quite kind of a stereotypical sort of thought to see autistic children who are like maybe lining up toys. And yes, we do see it quite a lot of the time. So it's sort of rigidity of thinking, rigidity of play, lack of social play, lack of imaginative play, as well as a lot of children on the spectrum could also have some sensory difficulties. So the sensory difficulties could be difficulties with light, difficulties with touch. So I've seen a lot of children that I work with, if you touch them, pat their arm or something like that, then they will look and they will brush it off. And that's because it's triggered a sensory reaction. Also in the mouth especially, that's why you see a lot of picky eaters. So you would see a lot of sensory difficulties in the mouth. So you'll notice a lot of children on the spectrum, not everybody, but a lot of them, would, if you brush their outside of their cheek or something like that, then you might get them turning away, they might brush it off, they might not like it. So we do have a lot of sensory difficulties. We do see a lot of sensory difficulties with children on the spectrum. Noise is another one. I have children that I've worked with who can hear a baby cry from, probably a mile away, and they will become upset, and I couldn't hear it, or it's very, very faint to me. But it just for some reason, that frequency of sound really, really, really causes anxiety in that particular child. And so something minor to us would be a major thing to, potentially to somebody who's on the spectrum. So that's just kind of a brief sort of overlook about, autism, diagnosis, and some of those, the traits for diagnosis. So now what I want to talk about is kind of those early signs. Usually the signs for autism, they should be noticed, or they would be noticed at a very, very young age. So parents might notice something. They might say they notice something unusual about their child at about sort of 12 to 18 months. But then it's not always fully recognised until a little bit later. In fact, it's very common for autism diagnosis to be delayed until about sort of 5 years old. But parents have always been aware that there's something slightly different about the development. So I'll just kind of run through some of those early signs and symptoms. Just some things that you can watch out for. So if you're worried that there's something different about your child's development, then you can just check these and just sort of see, okay, are they doing this or aren't they? And if you find that there are some of these signs, then by all means go see a developmental paediatrician or just a general paediatrician who can then refer out. So the first one would be if a child doesn't respond to their name. So from quite a young age, then children from about sort of even before 12 months, children would usually, when they hear their name, they will recognise their name and they will turn, unless they're very, very focused on something that's something different. But usually they would, if you call their name, then they will turn or they will come to you. And that would be from a very young age. If your child gets to about sort of 2, 2.5, or even 3, and they're not consistently doing that, then first of all, have their hearing checked. But then if that's not an issue, then it's just something to be a bit mindful of and something to be aware of. And especially if you have any, appointments with the doctor, then it'd be very important for you to mention that. So another sign and symptom, an early sign and symptom, would be a child who gets upset by just very, very small changes. So whether that's, for example, you've changed the type of biscuit that they eat, or whether it's something like today you're going to school, but the next day instead of going to school you're going somewhere else, and they go to a new place and they really have quite an adverse reaction, screaming, crying, whatnot. Sometimes it can be a minor reaction, but it's just that they have a reaction to this unfamiliar place. Another one which I've noticed with a lot of the children that I work with is if they do line up their toys, if you are to move one of those toys out of place, then if you see an adverse reaction, then that can be a bit of an early sign for autism as well. I work with children who do get very, very, very upset if you happen to move one of their toys out of position or you mix some toys up. So that is one of those early signs. Another thing would be kind of things like flapping hands or like a lot of spinning. So young children would often do a little bit of flapping hands anyway, especially as part of typical development. But if it seems quite severe, and if they persist, and they're still doing it sort of, up until about sort of 3 years old, and also on top of that, you see some of this spinning behaviour, and you see quite a lot of flapping, especially when they're excited or when they're anxious or upset, then that is something to be quite mindful of. So a lot of these things, children don't necessarily have to be on the spectrum to have these. They might be part of typical development, but it's just when they persist and when they become quite severe, then it's something just to be mindful of. Another big one, and I think this is one of the classic ones that everybody would know for autism, would be avoiding eye contact. So this is kind of a bit controversial these days. Like a lot of therapists work on eye contact, but now I think these days the research is coming that we don't necessarily have to work on it so much. So I think, but a lot of times the children who are on the spectrum, they do have difficulties really looking into your eyes. So they might do it for a brief moment, or they might. What I normally do in my therapy sessions is if I know a child has difficulties looking into my eyes or giving me the eye contact, which unfortunately as a speech therapist I will need sometimes because I need them to look at my mouth most of the time in order to get those signs. But if I'm really, really struggling with that, then I use little tricks. Like if they like Lego, then I might put a piece of Lego on my nose and I'll be like, look at the Lego. Or if they'd like another little toy, then I might put it on my face or put it on my head, so that at least we kind of get some of that, eye contact. But yes, really specifically avoiding eye contact would be one of those early signs. Another thing to look out for would be unusual eating or sleeping habits. So a lot of children on the spectrum, they come to me, and one of the things I have to do in an initial consult is look at background history and look at all the developmental milestones. One of the big questions as a speech and language therapist that I have to ask is about diet, and what they're eating, how they're eating, is there any eating or feeding difficulties. And I think probably about 80-90% of the time, then the parents will reply they're a picky eater. So if, children can be picky eaters. Children develop, they'll eat something one day, they might not like it the next. Their taste buds develop over time, and their, the type of food that they love will change. That is absolutely 100% typical. But if you have a child who's extremely picky with their food and really unwilling to try new foods, and like I said before, things like if they're really fussy with things like the brand of biscuit, if they can tell, or the brand of chicken nugget. I have children who can differentiate between a McDonald's one or a home one. Different types of cookies, which personally I couldn't tell you what type of cookie that is, like what brand of cookie that is, but they would notice these small changes. That is something that you should be just aware of. And the other thing would be those unusual sleep patterns. So a lot of times children who are, or individuals who are on the spectrum, also have poor sleep habits. So they have difficulties with sleeping. So they might stay up really, really late. So I've got a lot of children who I get messages from the parents, especially if they're going to school, and the child was up until 4 o'clock in the morning. They only got to sleep at like 4 or 5 in the morning, and then obviously they're having to get up at like 7 or something to then get ready for school. So they're absolutely exhausted. And so working on that, trying to get a good sleeping pattern for them is something that actually occupational therapy can work on that. They can work with the parents on that and just getting that kind of routine. I do understand the sleep pattern, the sleep routine is very different in Malaysia than it is in the UK. Typically for us in the UK, younger children like 5 years old would typically be in bed by about 7 p.m. Whereas here, I think it's a little bit later than that. I go out sometimes to restaurants and I see, young children out at like 9 or 10. It's the culture here, I'm not, saying it's a negative thing. It's different culture. But so then that's why it's good to work with those professionals, and especially a professional who understands the culture, so they can assist with trying to work on that sleeping routine. So just moving on, so another early sign of autism could be something like impulsivity. So that is when a child will just do something very, very quickly without even really sort of thinking about it. So they'll come in, for example, they'll come into my clinic and they'll be like rushing over here and they'll grab this. Or I've had children who have gone over and just randomly hit their father or hit their mother for, when there was no reason. I was having an exchange with them, not the parent. So things like that could be an early sign. So just a few more. And I think earlier I discussed a little bit about things like sensory issues or sensory difficulties, and specifically either we're looking for overreaction or an underreaction to those senses such as touch, smell, sight, taste, and sound. So you will often see some children with autism who will cover their ears at a loud sound. They get very overwhelmed in a shopping mall, and I'm sure everybody has had this experience where you've seen a child, lying on the floor in a shopping mall screaming or whatnot. And unfortunately, sometimes people walk past and think, oh, bad parent, or naughty child, when actually it's a child who's on the spectrum and they're just really having difficulties because there's so much sensory information for them to process. They're just completely overwhelmed and the body can't handle it. So they go into this kind of meltdown, shutdown phase. And if you think about it, I don't know about you guys, but for me personally, the past year, because of COVID, then you go into a shopping mall these days and they're empty. And so I've really gotten used to that. And then recently, because things are opening up, I went to a shopping mall and it was really busy. And I myself was like, oh my goodness, a little bit of anxiety, like there's so many people, what's this? And it's just because I'm out of it. But if you can imagine that feeling when you're surrounded with so many people and it's a bit overwhelming, but imagine that doubled or tripled, and imagine that just even on a quiet shopping mall day. But that's the anxiety level. So don't judge those parents. They're doing the best they can, and don't judge the children because they might be overwhelmed. So just two more for the early signs and symptoms. So another one which I kind of briefly touched on earlier, which is part of the DSM diagnostic criteria, would be those stereotypy patterns or behaviours, which is those rigid, repetitive behaviours. So like I said before, things like lining up toys, or I have a lot of children who love to take cars, like toy cars, and then they spin the wheels of cars, or they use their peripheral vision, or they love anything that kind of spins, or they'll just sort of play with those things, or they'll do some tapping, things like that. Another thing when we talk about sort of rigid behaviours is what appears to be sort of obsessive behaviour or obsessive interests. So for example, some of the children I work with really love alphabet or numbers or animals. And so they could sit and do an alphabet puzzle over and over and over, like 10 or 20 times if I allowed them. And also if they're doing the puzzle, if you stop them halfway through, then they might become agitated or upset or frustrated. So these are just little things, just to be mindful of. The last early sign and symptom, and this is kind of how it ties into speech as well, is often you will see as an early sign of autism is a regression in language. So usually around about sort of 12 months, children will start to have their first words. They'll start to be, babble and chat. And if you see that, and they do have these words, and then kind of around about sort of maybe like 2.5, all of a sudden your child regresses with their language. They stop talking, they don't make any more progress with their language, and those words that they used to have, they no longer have, or they still have them, they're just no longer using them. This is one of the big early signs of autism. So if you notice that with your child, if you think they did have those words and now they don't, this is a huge one. So this is one of the major ones that I would definitely suggest that you would go see a developmental pediatrician. So just before I move on to kind of specific speech and language difficulties, which is regression of language is one, I just kind of want to mention a child on the spectrum would not necessarily have all of these. These are just some of the signs that you can look for. And if you kind of see any of these in your child, then it's always best to just, see a professional and just have a chat with a professional about this. It might be autism, it might be something else, but it's always best just to get it checked out. So I'll kind of move on to specific speech and language and communication difficulties. Often these are things that I personally see a lot of with the children that I work with. And I work with children from 18 months up to 18 years. So I've got a huge range there. So I do see a lot of different difficulties. And as I mentioned before, every single child on the spectrum, every single person in the world is an individual. Everybody's different, so everybody presents differently. So these difficulties are kind of stereotypical, or a lot of commonly what I see. However, the children don't always have all of these difficulties. So the first difficulty that I would see would be intentional, the lack of intentional communication, or lack of pre-intentional communication. So that is, so they basically, a lot of children at a very young age, especially if it's more severe autism, they would lack communication intent, which means they're not communicating. If they want something, if they're hungry, they would actually do things like they would stack up a chair, or they'll put things on top of chairs in order to climb up on something in order to reach whatever it is they want, instead of asking for it, or even like pointing to what it is they want. They wouldn't have that communication intent. They just see this, I want this, so I'm going to find a way to get it. And they might not be aware that this situation that they're putting themselves in is potentially dangerous. So that's one of the big things that we work on as speech and language therapists. Is the first thing that we work on is being able to point and being able to request things so that they have that communication intent. So then after communication intent comes the preverbal communication, preverbal language. So this one is typically children would learn how to point, use gestures, things like waving hello, waving goodbye, would be typical development, and children who are typically developing wouldn't necessarily have to be taught these things. They would just naturally pick it up. If your child isn't using these, gestures, they maybe don't wave, they maybe don't point, then that is something that, so that would be, lacking those preverbal skills. So again, this is something that we would look for, and this is something that we'd work on as a speech and language therapist, is working on that pointing. You'll often see children on the spectrum, once they have some of that communication intent, then what they will actually do is they'll take your hand and they'll pull you, or they'll lead you to whatever it is they want, and then they'll kind of do this with your hand, and they kind of throw your hand up, to what it is they want, but they don't necessarily know how to point to what specific item they want. So then you're sort of left in this sort of place where you're kind of like, is it this? Is it this? Which is great for a speechy to work on yes and no, but then it can sometimes cause a bit of frustration with the kid. So we work on, teaching children how to point. Oh, is it this one? This one? Okay. And we will actually physically manipulate their finger and, help them to point. So that is one of the big things that we work on, especially in early young children. This is very, very important. If you think about it, as I've said 5 times already, 90% of our communication is done non-verbally. So next thing would be something called echolalia. Now this is a bit of a scary word to a lot of people, and if a therapist uses this word, then automatically parents will think of autism, and they do tend to kind of go hand in hand. So echolalia is basically when a child will repeat what you've said. So if I ask a question, the child, you could have immediate or delayed. If I ask a question and the child repeats back my question instead of answering the question, this would be classified as echolalia. Echolalia, like I said, there's a lot of stigma attached to this word. However, it is part of typical development. Typical language development does require, most children will have echolalia. What to look for is, and as a speech and language therapist, what I look for is, does this persist? Does it persist beyond sort of 3 years old? So usually younger children, sort of 2 years old, when they're starting to, combine words and having a bit more language, they will have a lot of echolalia, but it should taper off. So one of those signs of autism would be if that's not happening and they continue to have this echolalia. So it's not just repeating back my question instead of answering it. It could also be a lot of children who I work with will repeat back in the session. They will be repeating back, something that they've heard from their favorite cartoon. So you'll have a lot of that kind of, which is delayed echolalia. So we'll see a lot of that. And if that is not reducing by about sort of 3.5 years old, then that could be another sign of autism. So again, this is something that we would look for as a speech and language therapist, and it's something that we would assist to work on by giving children, processing time and things like that. So usually as well, children who are on the spectrum would have difficulties in both receptive and expressive language. So receptive language is the understanding of the language, so understanding the message that I'm saying, being able to follow those instructions. And the expressive language, of course, is the talking part. So usually you would see delays in both of those. So it's more obvious to see the delay in the actual expressive communication. My child's not talking, that's a difficulty. But then when we do the assessment, one of the things we always ask parents is about how are they able to follow instructions? Are they able to follow instructions with gestures or without gestures? Are they able to follow complex instructions? Like, if they can, you can say to your child, go get your bag and find your shoes. Can they follow, routine instructions like that? Can they follow, if you give them verbal, do they need visual cues? So again, this is one of the very, very common things, difficulties that we see as speech and language therapists. So receptive language and expressive language. And so that kind of follows into understanding instructions. So a lot of times then children who are on the spectrum may need extra support in order to understand instructions. So if you tell them to do something, they might not be able to process all of that information. So they might not carry out an instruction that you've asked. However, if you also give a gesture, if you also give them a picture or visual support, then they'll be able to do that. So they have difficulties understanding instructions and need a little bit more support in order to complete those instructions. And then kind of more sort of higher functioning, I guess, or higher level is children who are on the spectrum will often have difficulties learning to read and write. So we can also go the other side of things where you might have a child, and I've worked with a couple who are hyperlexic. Hyperlexic means that they have reading capability beyond their age. I have 2-3-year-old children who can read the word pineapple. I don't know how, but they can do it. But that's one of the things. But they might be able to read all of these words, but they might not necessarily understand. So they might not have the comprehension. So it's wonderful, if they come and you can, because that can be one of those tools that you can use to help support their communication is the written, if they're hyperlexic, is the written format. However, they might not always understand everything you're reading. So I sometimes have parents come to me and they'll say, oh, my child's reading this. And that's wonderful, it's amazing. Can they understand it? If you ask them a question about it, would they understand it? But also, conversely, then you can have difficulties with just the learning to read and write. So they might be a little bit delayed in learning to read and write. Specifically, the writing part would be referred to occupational therapists because they would work on things like the pencil grip and forming the letters. That's not so much in my remit, but certainly reading, then I would assist with that. Another common speech and language difficulty that we have with children with autism is the pronouns I and you. And children on the spectrum will often mix these up. It's such a common thing for me to see, and I have parents complain all the time. My child says, can I help you? Or can you help you? Instead of can you help me? And so it's just a very, very common thing. It's a very difficult thing because a lot of children on the spectrum tend to mirror us and mirror what we do. So you might see if I wave to a child on the spectrum like this, they might wave back like this because they're mirroring what you've done, what they've seen. As with language, so if I say to the child on the spectrum, my name is Stacey, then they'll say my name is. They'll say the same thing. So if I say what's my name, they'll say my name is Stacey. When I'm asking them what my name is, so they should say your name is Stacey. So that confusion or things that very simple one. If I say to a child, "Can I help you?" and they'll say, "Can I?" and then I'll say to them, "Oh, you need help," and they'll say, "Can I help you?" Because that's what they've heard, so that's what they're mirroring. So they do tend to get that mixed up, and it's a little bit confusing. I understand why. They do get that mixed up. I did two more. So the next one would be topic maintenance. So this one you might see with some of those higher functioning children or individuals is they might be a little bit rigid with their topics. So they love cars, they want to talk about cars. which is fine. But sometimes you want to talk about something else, or if I'm in a session and I'm trying to work on a specific concept or something, and they keep jumping in with the, going on about the cars, and they don't necessarily understand. This is one of those social communication aspects where they don't understand that just because they want to talk about it doesn't necessarily mean I want to talk about it, and also that is it appropriate to be talking about that right now. So kind of being able to have this topic maintenance, stay on topic when it's something other than their favorite subject, is one of those things that we kind of look for, is one of those things that we work on. And then the last one is, and you probably, if you know any children who are on the spectrum, especially those slightly lower functioning children, then you would notice a kind of robotic or sing-song voice. They tend to be a little bit kind of monotonal, or they tend to be a little bit sing-songy when they're speaking. And that's just, they don't seem to, as I mentioned earlier, they might not necessarily, part of the social communication, might not necessarily pick up those tones of voice. So for example, if we change the tone of our voice, it can mean something. So if I change the tone of my voice, it might mean that I'm angry. If I speak a little bit louder, it could mean that I'm angry. If I, start to rise up at the end of a sentence, then it could be that I'm asking a question. Like these kind of little differences when we're talking in the tone of our voice. Children sometimes who are on the spectrum don't pick those up, so then when they're talking, they can sound a little bit robotic, or conversely, then they pick it up too much and they sound very, very sing-songy, which I quite like, because I think I'm a bit sing-songy anyway. So that is some early signs and symptoms of autism. That is some specific signs and symptoms related to speech and language, things that we work on, things that we look for, especially when we're assessing your child.